Tracking. All attendees are in listen-only mode.
Hi, good afternoon. Today is April 16th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, and we also have Robert White, Director of Fiscal and Operations, Ron Peele, Chief Financial Officer, Nick Burton, CMRO Regional Director, Rhonda Workman, Director of Federal Programs, Patricia Sastoque, Director of Programs. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. And if you look at the panel interface on your right, you can click on computer or phone to switch for the best option in the audio section. There is a handout for this webinar, and you can find it in the handout section on the right, and they can also be emailed upon request. We are recording the webinar and posting it on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and I want to thank everybody for your continued support about attending these webinars. I also want to express my sincere appreciation for all of those who helped make these webinars come together. We've had multiple collaborators with DDA, some providers and families, etc., other state agencies, Dr. Feder from the CDC, etc. And, you know, as we continue to move forward with our transformation, you know, we want to have your feedback and recommendations to help us so that we can continue to support everyone. I have had some questions recently about, even after the pandemic, will we continue with these webinars? And the answer is yes, but I don't know what the frequency will be at some point. I think they are an important way to communicate to everyone. We get great attendance, and in knowing that we're going through a reopening at some point, what that looks like, what do the new services look like with people who want to use remote services, etc., then going back to total in-person. We know that we still have the issues from 2014 when it was enacted, the community settings rule, and obviously with the pandemic, etc., it's been extended by the Center for Medicare and Medicaid Services. But at some point, you know, hopefully when people are all vaccinated and, you know, when we've got this behind us, that we will go back to looking at the appropriate services so that people have a good and meaningful life. And while I'm talking about that, I do recognize that transformation is hard because it's about change, and nobody likes change. And, you know, as we continue to move forward, I want to be able to work with everybody and streamline and improve our service delivery system. I think that we appreciate and respect all of the hard work that people are doing on a daily basis, whether it be individuals and supports, whether it be our family members, our direct support professionals, our coordinators of community services, our providers. I mean, we're all in this. We're one DDA family, and we need to continue to work together so that we've got a great, flexible, person-centered, family-oriented support system so that people can have a full and meaningful life. So again, I appreciate your partnership and all of your collaboration. So thank you. Next slide. So again, our highest priority is everybody's health and safety and well-being. You know that we've seen some issues around people being vaccinated. I think everybody's done a wonderful job as we continue to move forward. I am committed to being as transparent so that people know exactly where DDA is and where we're moving with your assistance, your recommendations, your guidance, as well as what we do within the state portion of the DDA. So again, I appreciate everybody for practicing social distance, hand washing, and you'll see some upcoming numbers in a couple of slides from now. And I also want to encourage people to continue while we get vaccinated. You know, we've got pretty good numbers, but we're not 100% there yet. Next slide. So this week, as you know, that the governor announced that CDC says that more than 80% of people who live in Maryland, 65 and older, have their 80%, and 50% for everybody else who is 18 or older in the state. So I think that's really good. Again, the bottom bullet, if you recognize, that's how you pre-register. Or there's a number there, and obviously, if you don't write it down now, there's a way to see these slides when we post them, etc. Next slide, please. Also this week, U.S. Food and Drug Administration and the Center for Disease Control, CDC, issued a statement about the J&J vaccine and recommended a pause. And because of that, the Maryland Department of Health, which DDA is part of, but obviously there's concerns about all 6 million plus people who live within the state, that there was a pause put on until there is further guidance coming out of the federal partners of Food and Drug Administration, the CDC. Next slide. So I want to talk a little bit about, we've transitioned and everybody's done a very, very great job. I've mentioned this in the past. We had the EVD, which needed to be implemented for January 1. And I just wanted to share some numbers. We were extremely successful. I appreciate all the hard work of individuals, the providers, the case management, my regional staff, to get all of these person-centered plans in the system in LTSS so that the providers could begin billing. And so obviously we've got 4,600 people in those services, which is great. It affected 159 of our providers, which is out of about 190 providers. It's a pretty good, healthy number that actually are providing personal supports and supported living to people. And we know that we also had the pilot group have some numbers in there that they went live on December 1 of 2019 and started using the LTSS. And you can see the payments that have gone out is significant, $42.3 million in claims so far for personal supports and supported living. As we move forward, we've had some providers say that they would like to be, they'd like me to expand the pilot. And so we have 5 agencies that have self-identified that will be moving forward with this upcoming July. You can see on this slide that the group that we're going to call early adopters will go in 100% for their organizations, and they will move and transition from PCIS2 to LTSS. And you'll see in July, it'll be Penmar, Seek, and Jubilee. And in October, it'll be Jewish Foundation Group Homes and Abilities Network. And we've been meeting with them right along and been having discussions. Next slide. So I want to, hopefully people saw this. It went out, I believe, yesterday through Constant Contact. And we in DDA have been working with the Community Health Resource Commission. And as you know, that's an independent commission that sits within the Department of Health. And if you go back and you look at Senate Bill 496, it basically talks about having grants for Title VII. And it doesn't say in the bill, it doesn't say developmental disabilities, it's just Title VII providers, but that is our DDA providers. And you can see there's a link that went out. There are specific dates that you can see that what it looks like. And obviously it is for, and if you look at the second bullet down, it's for reopening, transformation, or any revenue losses. Applications will be beginning on May 10th, I believe, and no later than May 10th. And we have a webinar next week on the 21st at 10 a.m. so that people can, chat, ask questions, or whatever. I want to stress that these grants are non-competitive and that there are 6 different tiers based upon the revenue income, and then there's a dollar figure associated with that. This is totally administered by the Community Health Resource Commission, not DDA. So they handle this. Many of you who might have been around back in 2012 might have remembered that they also interacted with DDA and had a grant process for our providers back in 2012. Next slide. So the other thing that's come up is, Governor basically vetoed Senate Bill 796 last year. It was overridden this year. We are going through it to see, what is still relevant. And you can see in here that there are 7 items that were part of the EVV that were no longer relevant because we obviously went live with EVV in January. So we in DDA are going through all of this and looking at the 39 citations, the 37 requirements for reporting, etc., and everything else that we need to do. And I keep getting a lot of questions about, well, where is DDA with the SB 796? We are evaluating it, looking at it, and see what is required, what we need to do joint planning with Medicaid, because some of this stuff is beyond Medicaid, and also there's an area that touches EDD, the Eligibility and Determination Division, because there's some sections in there that relate to them. We also will develop a project plan that will be tracking our legislative requirements and align all of the timelines and put appropriate resources in place as we move forward with this. So I don't have any other information than that. We are working on it. When we get to a certain point, we will be sharing that whole plan, since it affects all of us in DDA. It affects participants because of eligibility issues and providers and families, etc. So as we move forward, we will keep everybody updated. Next slide. So this week we shared a FAQ, frequently asked questions, and it was updated on 4 days ago on the 12th. And this way it's a template, and hopefully it's a lot easier. And we've had a lot of positive feedback about the FAQs, but we thought we'd even try and do a new and improved version, and that's what we did. And obviously what's new, and then you see the link on the slide on the bottom where it says link and what's new, and that's included there for your reference, so you can take a look at that after this, and if you need to utilize it and take advantage of the information that we have on our website, please. Next slide. Well, this is a reminder that you should have received, you meaning the providers, should have received a email basically saying that we're looking at staff stability again for the national core indicators. And we need to do this to work towards building a stronger, more robust community system. I mean, one of the cores of our foundation is looking at the direct support professional and the provisions that they provide for people with IDD. And as you know, it's not just us in Maryland, but across the country that unfortunately the turnover rate and the statistics and whatever seems to be high, and we need to figure out how we're going to address that. And hopefully this type of data will give us information, and we can develop what's next steps collectively. Next slide. So the NCI started back in the late 90s. If some of you may remember, it started with about 6 or 7 states, and it basically is operated by the State DD Association. You see on the NASDs. and also the Human Service Research Institute, and looking at staffing levels, job stability, wages, compensation, and each state is asked to have 100% participation for their providers. So I am asking all of our providers to please, we've done pretty good in the past, but we can always improve. And, as we move forward and move the needle towards 100%, it gives us a little more data and hopefully a good representation across the state with the challenges of, urban versus rural areas of the state, et cetera. If you didn't get it, you should contact Patricia Sastoque, and she will contact this person who you see the link, Dorothy Hirschsteiner at HSRI, and she can get it to you. And again, this is your organization remains anonymous, but we really would like to get the data to see what we look like as a state, be able to look at it also against what of our surrounding states. How do we compare to Delaware, Pennsylvania, Virginia, district, et cetera? So, and even states that have similar populations to the other parts of the country. Next slide. So again, it's my expectation that we can get to 100%. It's due directly to them, again, no later than June 30th. And if you have any questions, as I said earlier, please contact Patricia Sastoque, and we can move forward from there. Next slide. So I know that our regional directors and the providers within the 4 regions have been meeting and having discussions about how and when and how we're going to reopen and what does this look like. And then, I appreciate all the careful planning and the guidance and everything that people are doing and looking at transportation, staffing capacities, your experiences with when you roll back and now reopening. You may recall that we had Dr. Hovermill last webinar talking about, triggers or indicators to watch for with people. I mean, we didn't have the luxury in March of 2020 when we had a pivot on a dime, but we do have a little bit of room and can do some planning that we didn't have that opportunity last year. So when we open up and, what does that look like? And, please consider participating in a brief survey that we did. And so we can take a look at reopening. We've in previous webinars talked about reopening, and we've given a couple of guidance that we had. And again, it's guidance; it's not mandated. But you as an agency in reopening, and families making a decision when their son, daughter, brother, sister go back into services, or even letting people back in their homes for personal support, et cetera, is an individual decision. And what does that look like as we move forward as a state and carefully plan for reopening? Next slide.
Hi, everybody. This is Nick. Happy Friday. I just wanted to share some information with you regarding the vaccine clinics, and one in particular that I wanted to talk about. I wanted to reiterate the DDA is continuing to work with local public health offices, continuing to work with providers to make sure that people are getting access to clinics within their communities so that we can get people vaccinated. Like Bernie has said, and I want to reiterate, we're getting there. We just need to make sure people are getting to these clinics and getting vaccinated so that we can put this pandemic behind us. One clinic that I wanted to highlight today, and more information will be forthcoming, is that Kennedy Krieger and John Hopkins, in collaboration with DDA and MDH, have been agreed to host a clinic. A series of clinics, actually, 2 in May and 1 in June of this year. The first clinic's going to be about 30 to 50 people. and the remaining clinics will be about 300 to 500 people depending on need. They're going to be drive-through, easy and accessible online registration. Sensory supports will be made available. And we will, of course, be sharing additional information regarding registration very soon. And I wanted to just point out, you know, this is two well-respected institutions within the state of Maryland really coming together and doing something similar that all the providers have been engaging in and hosting clinics. It's not easy, it's hard work, but the ones that I've been visiting and the calls that I've been a part of on helping facilitate these, and I think I can echo this across the state, have been amazing. It's been so wonderful to see everyone coming together on planning these. So we will be sharing more information and registration links in the near future.
Thanks, Nick. So before I start reporting on the COVID numbers as we've been doing on these webinars, I want to say thank you to everyone, and you know how proud I am of our provider leadership in hosting clinics and the number of people who get vaccinated and as participants and staff and family members, and you know, people who are self-directing. So you know, again, I can't thank you enough for all what you've done in moving forward with careful planning and making sure that people are vaccinated and safe. So let me give you some numbers as of April 15th, yesterday. The Central Region has 866 confirmed positive, 1,234 negative, and have 53 people who have passed away. The East Region has 150 positive, 426 negative, and 6 people who have passed away. And in the South Region, there's 625 positive, 237 negative, and we've had 26 people pass away. And in the West Region, we've got 366 positive, 407 negative, and we've had 17 people pass away. As far as direct support, the South Region is 418 positive, and 5 people have passed away. The West Region is 208 positive, and 2 people passed away. The East Region is 223 positive, and said 1 person passed away. And the Central Region is 676 positive, and 2 people have passed away. Next slide. So this information is from week ending yesterday, 4/15, and you can see the pie chart on the left is we've been keeping that number stable with the 17,764, and the number of people who have tested positive is about 11%. And so the chart on the right then shows the regions through the 15th, and then you can see how it further drills down in showing the numbers. Like in Central, there was an increase of 7 and 0 in East, and 5 in South, and 2 in the West Region. So I think everybody is doing an outstanding job, that the numbers aren't higher, that they're much lower than previously reported. And I think it's due to people's due diligence and everything you're doing about people getting vaccinated, using PPE, washing hands, face masks, etc. So I think as administration, we are doing really, really well. So I want to applaud you and thank you. Next slide. So obviously, from March 18th to April 15th, we've had 1 participant that passed away. And so who had tested positive, and you'll see that the pie chart on the right. And total, we've had 102 people who had passed away. So, again, that's a long stretch starting from March 18th. Unfortunately, we get from the beginning of this, and about a year to date, 101 people have passed. But as we continue to move forward, I think everybody is doing a good job in ensuring people are safe. Next slide. So this shows people who are self-directing the services. Obviously, there are 37 people who have tested positive, and that's an increase of 1 since the last reporting time. Next slide. So, as I said earlier, we need to get hopefully better with responses to either vaccination tracking and/or the national core indicators and whatever. And I asked for people's cooperation. You can see here that we've got 14,588 participants. And if you think on an earlier slide, we basically showed that we have 17,764. So we are a little light on where we are by about 3,000 or so. So I'm going to ask everybody to let's keep moving forward and hearing from all of our agencies. You can see that we've got 71% of those folks of the 14,000 who have been vaccinated, which is really good, at about 29%. And we know that we've got additional clinics like Nick just talked about, but also we've got more clinics coming up. We've had 118, and we've got 22 scheduled in the future. And if you are looking to schedule for your agency, you can go to your regional director, who will then contact Tanya Ferguson, who's our point person on that. So here we are with vaccination tracking on the next slide. And obviously we're looking at the number of people, and it's over 1,000 people and family members, and that's an increase of 141 from the last time we reported. And we looked at administrative staff in agencies, et cetera, and that's an increase of 315. Direct support professionals is 7,800, and that's an increase of 938 from the last reporting period. And we're up by 160 more individuals who are self-participating to get to 297. And, I still encourage everybody to complete the weekly tracking so that we can gauge, how far we're coming, what we need to do next. We're also asking the CCS's, community coordinators of community services, that we need you to start reporting on people who are on the waiting list and people who are in self-direction, so that we can get everybody vaccinated within our system. As you know, that when we say there's 24,000 people, that includes people on the waiting list who are getting case management services. And with that, I'm going to turn this over to Robert, our new person, who is the director of fiscal and operations, and Ron Peele. Thank you.
Thank you, Bernie. Good afternoon, everybody. So with the next series of slides, we just want to take this opportunity to sort of reiterate some of the information that's already in the guidance, but also to sort of highlight some of the new things that are in the guidance that we recently released as recently as yesterday. Under the DDA's Appendix K authority, providers can bill retainer days during the public health emergency as follows. Community living group home up to 60 days at 100% of the rate. For meaningful day, they can bill up to 30 days at 80% of the rate. And for personal supports, providers can bill up to 120 hours or 30 days at 100% of the rate. More information can be found at the links below. you go to those links, you can get more details. We have the Appendix K approval document there. Then there's a link to the actual guidance that we released yesterday, the revised guidance. And the third link is to look at the guardrails related to your attestation. Next slide, please. So under the guidance provided by the Center for Medicare and Medicaid Services, CMS, providers are required to submit quarterly a completed attestation that will be verified by DDA to ensure compliance with the CMS guardrails for retainer payments under the provisions of Appendix K. CMS has advised us that the guardrails are effective retroactive to March 13th, 2020. This is something that is new in the guidance that was released yesterday. So we just wanted to underscore that for providers, that confirmation about the retroactive date for the application of the guardrails. Again, there's a reference link at the bottom there that will provide more information on that. Next slide, please. Further clarification from CMS revealed that states now have the flexibility to allow some retainer payments to cover base costs during periods of times when staff were laid off. And based upon this guidance, DDA has decided to allow providers to bill up to 60% of retainer day funding during staff layoffs to cover set non-staff related agency costs. Again, this is also included in the recent guidance that was released and sent out by DDA on yesterday. Next slide, please. And here, this is an illustration, an example of the Attestation Form, which most of you should be familiar with. It's posted on DDA's website, and it's been posted there for some time now. We just wanted to illustrate what the provider, what you would do when you're filling out the attestation form. The arrow at the bottom pertains specifically to the guardrail related to staff layoff. So the only thing that you would need to do as a provider is to simply read the instruction and read the guardrail and the attestation, then check. In this instance, you would check no, and then put the period from start to end that the provider is reporting on. Next slide, please. Federal requirements are that providers cannot profit from a public health emergency. So in order for us to facilitate this, during the cost reporting year-end reconciliation process, DDA will make an assessment of revenues, whether from the additional revenue from PPP loans or other revenue sources, along with the revenue from retainer payments for the same programs, to see if it demonstrates a profit for the provider. If a provider receives revenue in excess of the pre-public health emergency level, then any retainer payment amounts in excess will be recouped during reconciliation. Next slide, please. So the next series of slides, we just want to take an opportunity to walk through some of the FAQs, which also were recently loaded, or I should say posted on our website. So the first here is, if a provider laid off staff, but have already submitted and been paid for retainer days, how will DDA, or how will we, notify DDA that we are not eligible for these days? When can we expect recoupment of these days? What the provider would need to do in this case is to complete the quarterly attestation that notifies DDA that staff was laid off while retainer days were billed. I wanted to reemphasize, though, based upon the flexibility granted by CMS, DDA has decided to allow providers to bill up to 60% of the retainer days, even if the agency laid off staff during the time retainer days were billed. To effectuate this, DDA will recoup the difference of retainer day funds during year-end reconciliation through the cost reporting process. Next slide, please. Okay. So how do we note this in the cost report, as the days in PCIS2 will not match our cost report submission? In the cost report document template, there is a Schedule G on the cost report that is used to note and explain attendance discrepancies between the provider record of attendance and PCIS2. So funding cannot be used for the same program. Yes, as earlier mentioned, one of the guardrails contained in the CMS guidance on the use of retainer days is that the agency cannot use revenue from retainer day billing and other sources of outside revenue for the same or duplicate purposes. Next slide, please. Due to guardrails suggest we cannot have received other sources of funding at all during Appendix K, or those funds cannot be used for the same time period that the retainer days were billed. Again, the guardrails contained in the CMS guidance on use of retainer days stipulates, number one, the agency cannot use revenue from other sources and revenue from retainer day payments for the same program. That's known as the duplicate uses. Secondly, revenue from retainer payments cannot cause an agency to exceed its revenue prior to the quarter before the public health emergency, less savings achieved from staff layoffs and/or furloughs. And thirdly, the agency cannot lay off staff at the same time as they are receiving retainer payments, or it will be subject to recoupment of retainer payments. And on this third bullet, again, we have decided after subsequent guidance from CMS that we're allowing agencies to bill up to 60% of retainer days related to the layoff guardrail. Next slide, please. What if you laid off staff in a different quarter during Appendix K than the quarter you are billing retainer days? The agency is able to bill up to 60% of the retainer day. If the total revenue as a result of the retainer day exceeds the amount of revenue earned the quarter prior to the public health emergency, minus savings as a result of staff layoffs or furloughs, then the DDA will recoup the difference during year-end reconciliation through the cost reporting process. Next slide, please. Page 24 says, providers who entered up to 30 retainer days since March 13, 2020 do not need to take any action. Providers who entered up to 30 retainer days for meaningful day services since March 13, 2020 would not need to complete error updates to adjust attendance. However, the provider is required to still complete the quarterly attestation in accordance with the CMS guidance pertaining to guardrails for our documentation during the year-end reconciliation process. Next slide, please. Our retainer days were submitted correctly, but we did receive a PPP loan. What should we do at this point? If your retainer days were submitted correctly, all you have to do is submit the quarterly attestations pertaining to the guardrails contained in the CMS guidance. During year-end reconciliation, you will need to report the receipt of funding during this period of time to determine if you meet the federal requirements. Again, that year-end reconciliation process is the point where we will look at all of this and compare all of the documentation, i.e. the cost report, financial statements, the attestation documentation, and review and make some determination at that point. Next slide, please. There's a guardrail that relates to revenue not exceeding the quarter prior to the public health emergency. Is this revenue on a total level or by program? This is total revenue. Again, when you bill for retainer payments, presumably related to a service that you are rendering on behalf of our DD population, that if you're getting outside revenue along with that to support the delivery of that service, then that would put you in a situation, like I said, when we look at your statements of being subject to recoupment of funds, because it stems back to the not being able to profit from the public health emergency by not exceeding the revenue for a period of the quarter, comparing the quarter prior to the public health emergency. Next slide, please. This is a schedule of the attestation submission schedule, I should say. One point of note is that the second row, which is the should be April 10th date that you all should have submitted at this point, but this is the full schedule, and this is also can be found on the website, the link that was provided earlier. You'll see this schedule along with the other documents for the attestation and other information pertaining to retainer days. Next slide. There are updates that affect FY20 retainer days need to be submitted to the regional offices by noon, May the 3rd, 2021, for the following services: residential/community living group homes, personal supports, and meaningful day. I just want to emphasize here, this is an update that came out in the recently released guidance that was sent out yesterday. We wanted to extend by at least another week to give you all the opportunity to, get your updates for FY20 done and have enough time to complete that to get the information in for the FY20 cost reports. Next slide, please. And that concludes this portion of the presentation. Are there questions?
Thank you, Ron. Yes, there are questions in the chat box, so I'm just going to start from the beginning. Let's start with Nick. Nick, this question is for you. In reference to the Johns Hopkins Kennedy Krieger Clinic, is it only for people in services or also for people in DD, not in DDA system? We have some high functioning who fits into the DD category but are not getting services from DDA or have not been able to get an appointment. Nick, if you're talking, we can't hear you. Rhonda, can you hear me?
I can hear
Ron,
you.
can you hear me? Okay, great,
Yeah,
thank you.
I can hear you.
So I'm not sure if Nick, his mic is not working or not, but we definitely be happy to share that and move on from that category. I do know that is, Nick, are you there? All right. Well, I know that we are, it's going to be a large mass clinic. There's going to be lots of opportunities. Let me find the answer and we will get back to you. Okay. All right. So the next question is for Ron. Ron, if an agency receives a PPN loan for $1 million on April 24th of 2020, and that loan is for 24 weeks, is the full amount of the PP fund counted as income in the fourth quarter because it was received on the fourth quarter? If so, PPP funds are restricted as to their use and could not be fully expended in the fourth quarter. So would the amount be prorated?
Well, let me just answer this in general. I don't know if Robert want to add into it. But if you received a PPP loan, as CMS has advised us, we are difficult for DDA, or for that matter, CMS, to pinpoint the period of, when the loan was received, when the, if it's an unforgivable loan, when all of that is sorted out. So what they've advised us is that if you receive a loan that goes towards the support of that service or that program, and it pushes you over the threshold to realize a profit of that, during the public health emergency compared to that prior quarter, then you're subject to recoupment. I don't know if there's anything Robert had to add to that.
No, that's correct, Ron. I think you said it. Every time when we had this discussion with CMS, anything dealing with loans or anything, there was no further guidance except for refer to the guardrails. They can't double dip, use two sources to fund a program and or service. And the number two is it can't profit from the public health emergency. And so that's all of the guidance that they gave us regarding the use of other funds and or loans and timing of forgiveness, et cetera.
Thank you. Ron, can you define the period in terms of the last full quarter prior to the public health emergency? What is the last full quarter prior to the public health emergency?
So that would be the quarter before the March 13th is when we officially, that's when, it would correspond to the CMS, guidance in terms of guardrails and when everything is applicable. So the date given is March the 13th, 2020. So it will be the quarter prior to that time period. So that would be, I guess, considered the second quarter prior to March 13, 2020.
Thanks,
Right.
Ron.
So
Yeah, one way to think of it is it's the last quarter that was paid in, when you had full payment and you had full staffing. And so that's sort of, as Ron said, would be prior to the public health emergency.
Thanks, Robert. The next one is a tie-in to that, and it says guardrails on revenue not exceeding the quarter prior to the public health emergency. Does that mean state of Maryland revenue only or total agency revenue?
It's revenue. So if it's whatever the source is, so there's retainer revenue, retainer day billing, and then any other source of revenue that the agency is receiving. If by virtue of billing for retainer days, it pushes you over the threshold of realizing a profit, then those funds could be subject to recoupment during reconciliation.
Ron, the next question is, do we need to do an attestation if we did not use retainer days during a specific quarter?
Well, if you did not use retainer days for a specific quarter, you would not necessarily have to do an attestation for that. But there's a schedule for about 6, I think, or so attestations. But you do have to, whenever you've used those retainer days, you have to report for the record when you use them. So if you didn't use them for, let's say, second quarter, but you used them for, first quarter or third quarter, then we would expect to see an attestation in there for that, because we have to have something for the record when we're doing our reconciliation.
Thank you, Ron. The next question is, we have revenue from several sources. How will DDA determine how much of PP applies to possible pullback?
Sorry, could you read that again, Patricia?
Sure. We received PP loans. We have revenue from several sources. Mm-hmm. How will DDA determine how much of the PP applies to possible pullback?
Well, I think the standard is really it's comparing your revenue, inclusive of the retainer day payments with all the other sources of revenue, and comparing that to that quarter that we're talking about as the baseline, the quarter that was prior to the public health emergency. So when you bill retainer days, if it takes you over the threshold, then that means that those funds are subject to recoupment. The guidance further says that if you already have a certain amount of revenue and you then bill for retainer days, and that takes your revenue, from that point further, then more than likely you're going to be subject to recoupment, because you can't, as Robert said before, you can't use the retainer day payments for programs and services that, where you're already using other sources of revenue to support those programs and services, PD program and services.
Thank you, Ron. The next question is, we received a PPP loan in May 2020. It was recorded as a liability, not revenue, in our audited FY20 financial statements. How do we report it on the cost report, since only revenue is required and must tie to our financial statement?
Okay, so you can, in your financial statement, you can report it as a liability, but if it is used in support of providing those services, where you bill for retainer days during the course of that time frame, excuse me, lose my voice, then it will be subject to that guardrail and subject to recoupment.
Thank you, Ron. The next question is, how will DDA consider revenue from increased number of people supported, such as transitioning youth? Revenue can increase without there necessarily being an increased profit.
Well, I would say in that case, if you are talking about revenue, DD revenue, by virtue of bringing in more, serving more people, that is, I don't think that's. I think the issue is really comparing other sources of revenue outside of DDA supported services. Okay, so we're paying providers quarterly to provide services, and through that process, we're paying a certain amount for certain units of service at a certain rate. And if the provider has increased the level of that service or increased the number of people providing that service, that's one thing. And bill for retainer days, that's one thing. But the issue in terms of the revenue is when you're doing it that and you're billing for retainer day, you cannot have another source of revenue outside of this service that you're getting paid for from DDA to provide to support that service. It says you have to, CMS has advised us that the provider has to choose one or the other source.
Thank you, Ron.
The next question is, if the staff who were laid off or furloughed were administrative staff versus a direct support professional, do the guardrails still apply?
I think that that if the administrative staff are, connected to the delivery of that service, in support of that program, I think that those, those would be subject to the guardrail, because it's in support of their program and it's being supported by, presumably being supported by the billing for that retainer day payment. And so, it's supporting that delivery of that service, then I think that will be subject.
Thank you, Ron. Ron, I think we have about 4 minutes, so we can do 2 more. I do want the audience to know that we have over 50 to 60 questions in reference to this topic. As you heard, Bernie talked about the FAQs. We will be sharing this with Robert and his team and generate additional FAQs so that you guys have the proper supporting guidance. So let me do one, and then Rhonda, you do the other, and I think that'll put us at 2. So Ron, should the attestation have some max range of layoffs? For example, the percentage of staff, percentage of program staff, or what happens if you just laid off 2 people? Do you lose out on opportunity to use retainer days?
You don't, I mean, you can still bill for retainer day, but as I said earlier, we've decided to allow agencies to bill up to 60% of retainer day.
Thanks, Ron.
Hey, Ron, additional question. The updated guidance shows the period of the 4th quarter attestation to be 9 months or 3 quarters. Should we not be doing separate attestations for quarter 1, 2, and 3 so that a quarter-to-quarter analysis can be made?
Well, we sort of lumped them together that way to just kind of get the schedule, when we received the CMS guidance, to kind of get the schedule to align and to keep track of where we are now in FY21 relative to the past fiscal year. So that's kind of why we laid out the schedule that way. But again, it's in a sense, it's really this is really for documentation purposes, because really the attestation is kind of just telling us, oh, yes or no, I did not meet this guardrail. And it's recording that time period, because when you submit your cost report, all of the detail and documentation is in the cost report, the financial statement, and that kind of shows all of the revenue, your expenses. That's where the real detailed information goes in that we will be looking at when we're doing this reconciliation process.
Thank you, Ron. I think that this brings us to a conclusion. I'm going to turn it to Bernie to close us off. And please know that we will be sharing all of these questions with Robert and his team and Ron to provide some additional FAQs to post on our website. Bernie?
Well, again, I want to thank everybody for all of the hard work that you're doing. I mean, our numbers are not going up. You're keeping people safe. You're working to get vaccinations for individuals in your agencies and other agencies. And, you know, you're considering what it's going to look like when you think about reopening and do that careful and thoughtful planning. So again, I want to thank everybody for participating today, and please have a safe and restful weekend. Thank you.